Hi everyone. I'm Saja and welcome to our third EPHSA talk. It's really wonderful to have everyone amongst us. And we also have our two amazing speakers with us. For those who are joining for the first time, EPHSA Talk is a platform where we aim to bring together public health professionals so that we can, talk about public health, build networks, and share everything about public health. And today we have, as I said, two amazing speakers. We have Karl F. Conyard, who will be speaking about ASPHER-WHO Core Curriculum Program for Public Health. Karl is the Core Curriculum Program ASPHER Fellow based on UCD School of Public Health, Physiotherapy, and Sports Science. Karl's work before joining ASPHER was in the area of population health and epidemiology, working within Ireland's National Health Service, HSE, as an operation manager in COVID-19 contact management program, overseeing the National Specialized Clinical Contact Tracing Team. Karl's original background was in auxiliary nursing. He then completed his BSc in Health and Society at DCU and attended his Master's in Public Health MPH degree at UCD and is on the Mature Entry Medicine pathway at RCSI, Ireland. Karl has attended the RCI Certificate in Lifestyle Medicine. He is also a qualified national officer at statistics via the Central Statistics Office in Ireland. Karl is also a fellow member of the Royal Society for Public Health UK and the Royal Statistical Society in UK. Karl is also an affiliate member of the Royal College of Surgeons in Ireland. I would like to welcome Karl. And we also have our second speaker, Katya Manuella Permana. And Katya will be sharing about how she started her journey in public health through EPH and how we can start our journey in public health through EPH. Katya is a recent graduate from Europubhealth Plus 2021-2023. She completed her first year at UCD and her second year in EHESP Paris with a specialization in environmental and occupational health. Previously, an R&D scientist at biopharmacheutical factory in Indonesia. She started her career in public health through the EPH Plus scholarship. She is currently working at the French Agency for Food, Environmental and Occupational Health and Safety, Anses, as one of the project manager for the Horizon Europe funded project called PARC, Partnership for the Assessment of Risk from Chemicals. So I welcome Katya as well. So just before we start off and we give the floor to our speakers, I would like to share that this session is being recorded, and if you have any questions to our speaker, please feel free to use the chat function, and we will be giving 20 minutes each for our speaker, and we'll have 20 minutes at the end of the session for question and answers. So yeah, I would like to give the floor to Karl first.
Okay, everyone. So thank you very much, Saja, for that gorgeous introduction. Now, I will admit I'm in a room with censored lighting, so if you see me going like this halfway through the talk and I seem to fade out, I'm just trying to put the lights back on again, so I do apologize. Very much. My name is Karl F. Conyard. Most people know me around Europe as KFC, not the fast food chain. And essentially, I've came to public health from, as I just said, a nursing background, and I sort of fell into public health and absolutely fell in love with it, to be entirely honest, and sort of went into teaching directly after that and research, which I've absolutely loved. Not many people get the chance to work in their alma mater, specifically for as long as I have. I've had the pleasure of working in UCD in the School of Public Health under Professor Mary Codd for the past 7 years. So I have been absolutely so lucky. I'll pop them up. But essentially, I am the ASPHER Fellow. In ASPHER, as you can see, the other direction, for God's sake. Anyways, the Association of Schools of Public Health in European region. And essentially, the hallmark of what ASPHER do is keeping education and research to a standard for public health across the European region. Now, when I say European region, I mean in regards to WHO European region, and that includes the Middle East as well. So, and we're so blessed to have that diversity at ASPHER as well. So, as I said before, I am the ASPHER Core Curriculum Program Fellow, and we are so lucky in ASPHER that we're working in accompaniment with the WHO Europe office for the Core Curriculum Program for Public Health. and it's absolutely fantastic to have the opportunity to speak about it. So I always like to really point out this important fact, the importance of young professionals. And wherever you go in Europe, specifically for the students here, you are joining a family. And the great thing within the public health family is we try to look after each other the best way we can and provide opportunities the best way we can, both in academia and in practice. And it's sort of interesting with public health because the scope of practice really changes. Here are the traditional public health knowledge and skills, which have been known for millennia from the Victorian era all the way to now. Things like epidemiology, biostatistics, research skills, social epidemiology, chronic disease infection health policy, global health, health economics, and health promotion. These have been the cornerstone of public health. But we have to sort of remember that in education, we need to move our education with what the landscape presents to us, the public health landscape. And with that, as we can see here, the new public health is changing rapidly, from demographic shifts to global inequalities, to political strife and unrest, to war as we're seeing, to climate health, water insecurity, food insecurity, the digitalization of public health, preparedness, and of course, migration. And the thing is that we really need to ensure that our education systems are able to train the public health professionals of tomorrow in a way that we can combat these things which are not just on the horizon, but are currently affecting public health practice and public health research this very day. And one may wonder the strengths of this. And public health education, research, and practice has grown exceptionally. Young professionals, thank God, come with knowledge and skills of those before us from other areas, which is important. Enthusiasm, greater understanding of the connectivity of public health. We come with special interests and historical awareness, and also connections. And my sort of wish, maybe it's far-fetched, but sure, let's go for it. I hope that our generation is a generation who can break the old silo system. Because as we know, we have seen what this does, putting one's head in the sand and not changing education and practice in alignment with what is actually happening in the larger landscape around us. It's just an introductory video. It's on the website. But again, this is where the caveat of the ASPHER-WHO core curriculum program is at its heart, and impinging ASPHER's absolute goal and raison d'etre is essentially dedicated to improve and protecting the public health by strengthening education and training of public health professionals for both research and practice. And one would ask, well, why a curriculum? Well, we all want to be competent in what we're doing. And one requires competence. And to get competence, you need competencies. And to have competencies, you need to have a good curriculum. And originally, ASPHERs historically used to create competency sets, which were very, very useful. But now we seem to be awash with competency sets across public health. I never knew this before starting this project, but there are over 170 competency sets for public health around the world. But what's really, really important is that we can't forget about the fundamental curricular elements needed to enable public health professionals to be competent in their speciality. And a core curriculum for public health needs to be able to be relevant to public health academia and academics, but also to training programs to support the core competencies of public health professionals. Pardon me. So, how did we get to this point within the CCP? Well, phase one was finding the experts. We carried out a survey which went across to all of our member schools and ended up finding 491 notifications of expertise across our linked schools and institutes within ASPHER. And the phase two was really the start of that bottoms-up approach. requesting detailed curricular elements from schools and collating of concept maps into subject areas, teams, and curricular elements for all the different subject areas. Phase 3 was the consultation on curricular content. Phase 4, which I can say very gladly that Saja helped with very importantly, was the subject-specific surveys on agreeable of inclusion into curriculum and agreeability on education level of delivery for different subject areas, their teams, and of course, their curricular elements. And now we're currently at phase 5, which is the expert advisory groups who are currently bringing things to a much more concrete form. So our end product is understandable, relatable, but also in alignment with what's happening to public health in this very time. And the young professional involvement has been so crucial to this, from active members on the CCP team, active opportunities for connections all the way through, experience in data analysis and Delphi processes, members of phase 3 in the consultation and curricular content. We have lots of young professionals on the expert advisory groups, members of the expert consultative group as well, and active leads on the EAGs, as well as heavy YP involvement in the past Deans and Directors meeting in Dublin. And we've just been so lucky for that. And very much all of these things were collected and brought together. And 4 very large domains presented themselves. And here's one of our infographics here, and that QR code will bring you to our website. But the core curriculum has been very handily broken down into 4 key domains. The first one being core subject areas in public health, the second being subject-specific areas in public health, core cross-curricular subject areas in public health, and core interdisciplinary professional skills in public health. And you may be asking, oh, well, what does all this mean? Now, I will note a word of caution. The next table looks quite packed, but do let me walk you through it. So here is the ASPHER-WHO core curriculum program, the structure of it. Within our core subject areas in public health, we of course have the tried and true subject areas, which we've all carried out in some element in our public health training, both at bachelor level, but also at master level as well. Demography, epidemiology, public health research methods, biostatistics, and data interpretation. Very, very important key subject areas, as well as determinants of health, health protection, disease prevention, health promotion, public health ethics, law for public health, which is becoming a very, very important element in the public health sphere, along with economics in public health and health system organization. Now, when we think about subject-specific areas in public health, these are more sort of, one may even say, the different streams within courses that you see around different universities around the European Union and the European region. And we see subject areas like communicable disease epidemiology, epidemiology of non-communicable diseases and disability, occupational epi. We also see the very important areas of environment and climate health, public health nutrition, architecture and health. And also what's really become very, very important, as I'm sure we can all appreciate, is the importance of emergency preparedness, disaster management. We only have to look at the previous pandemic of COVID-19 to actually truly appreciate the importance of preparedness and disaster management. It can't be said that one of the really most important areas that is really presenting itself in this time currently is the whole area of conflict and war in regards to public health, along with public health and criminal justice. When we look at the cross-curricular subject areas in public health, these are the topics, subject areas, which should be interseeded nearly in all of these different subject areas. For example, the importance of historical, cultural, sociological, economic, environmental, commercial, legal, and political determinants of health. These are the different lenses that we need to be looking at curriculum at. When we specifically look at diversity and intersectionality, health in vulnerable populations, psychology, mental health, and importantly, well-being, which have really come to the fore specifically thanks to the COVID-19 pandemic. And of course, when we look at the importance of digital transformation in public health literacy, and of course, the importance our generation is truly needing to get our grips on is the whole area of infodemiology, how information is passed around, how very much the epidemics of information, both good and bad, both misinformation and true information. And then when we look at our core interdisciplinary professional skills in public health, we can't forget about those key skills that we all find important. For example, critical thinking and evidence synthesis, integrative learning and action, bringing all of these subject areas together to create, for example, a thesis or a project, an action project. It can also include the very important elements of work experience and a practicum, but also the important skills of communication skills, public health advocacy, negotiation, and evidence into policy and action, along with the tried and important elements of collaboration partnership, specifically public, private, and charitable, specifically leadership and management, which in many countries throughout the world, specifically over the pandemic, we've seen where leadership and management of health systems, of availability for vaccinations, were quite difficult. And of course, implementation science. And within all of these subject areas, there are specific subsets. For example, when we look at, for example, the very important area of disease prevention, we have our vaccinology sub-area. And the vaccinology area has become close to the fore of what is important in regards to vaccines, to populations, and the importance of the prevention that they carry out. Moving on now, this is just another QR code to bring you to the website, but some questions on what are we trying to do? And very much so, we look at what the CCP is addressing, the challenges which are out there. And it's addressing the old age question of how do we keep in currency? And the core curriculum program will need to, in the future, be carried out again and again to ensure that education and practice is staying within currency, staying, in other words, up to date. And it's very important for us to keep on top of these new trends as well. I can remember when I carried out my MPH, infodemiology was not thought of, to say the least. Wasn't that buzzword wasn't even thought of. And now what some people regarded as a buzzword is now an entire subject area, which is so important. But the true question comes, can all schools really teach all of these elements? And this curriculum comes with, shall I say, a bit of a clinical, one would say a clinical red sticker, but let's remove the word clinical, but a red sticker. It is downright impossible for all schools of public health to be able to teach all of these different elements. And the one thing that we need to remember is that public health education needs to remain in connection to the landscape that it surrounds. And very much so, subject areas in regards to war, for example, will be very much useful to countries, schools of public health, which are facing that challenge or are close to a country that's facing that challenge. The same can be said for the area of different subject areas which are more relevant to different countries. And it's so important that the CCP, and it's one of the things we do envision, that through ASPHER, we will have this amazing connection to connect different schools together. So that if one school is a little bit deficient in a certain subject area, that, well, one of the great things, thanks to COVID-19, was, well, people's use of technology increased. So having a lecturer Zoom in to give a class on a specific subject area, which maybe a school isn't able to actually present or have the expertise to give, is given in a different way. And that way, students are able to be equipped with the skills and be hopefully competent along the way with their knowledge of these different subject areas. And that's me. I tried to keep in time. I hope I did. And if anyone has any questions, and I'm sure Saja will give the house rules in that.
Thank you, Karl, so much. You're right on time. And yeah, just I also, like you shared, it has been really a comprehensive process, and it is really wonderful to be engaged in at least one section of the process last summer. And it was really really inspiring that how you and Professor Mary Cod have been working on this throughout, and it will be really interesting to know more about it. And I guess a lot of people here would have a lot of questions at the end of the talk. So thank you so much. It was really amazing to learn about the different core components and core sections of the public health curriculum. So yeah, I'll move on to Katya now. Yeah, I'll welcome Katya.
Hello, everyone. I'll try to share my screen first. And also, like Karl, my room might get dark automatically, so I'll have to do the thing also. Hi, everyone. My name is Katya, and I come from Indonesia. And as Saja has introduced me, I'm an EPH Plus 2021-2023 alumna, the most recent graduation batch of EPH Plus, but hopefully I'll still be able to share something of value with you today. I will share with you how my public health journey started, a little bit of my current work, my thesis, and hopefully some resources for those of you who are interested in working for an EU-funded research and innovation program. Because that's where I'm currently working at. Firstly, I would like to know the demography of the attendees today. I see a lot of current students, but is there a potential student that are planning to apply to this program? Maybe give a reaction or something? Or is it all current students? So yeah, I think we're all EPH family here, but it's okay. I'll continue on anyways. So a little bit about myself. I did my bachelor's study in biomedical engineering at Swiss German University in Indonesia. The university was located in Indonesia, but we were given the chance to do an internship semester in Germany. So I did it in Karlsruhe Institute of Technology, doing cell culture on biofunctional material at the Professor Levskin's lab. And as you can see here, this is a very old picture because the Notre Dame is still standing there before the fire. I believe that this experience was one of the things that attracted me to go back to Europe somehow. And the experience in the lab was what got me accepted to my first job after graduation in 2016. After achieving my bachelor's degree, I started working at an R&D department in a biopharmaceutical company in Indonesia for almost 5 years. So here's me with a protein purification column. And then I applied for the EPH Plus scholarship program in the hope to be able to work more with people and see the impact of my work, which I felt was a little bit hard to do while I was spending most of my time doing a wet lab in the lab. Like, I did enjoy some aspects of doing science in the lab, but I was also excited to get a change of scenery and enter a new field of study. So as you can see by now, I do not come from a medical background, nor did I do a bachelor's degree in public health. Therefore, in my scholarship application, I had to pivot and explain why I wanted to change the direction of my career. So I decided to apply for the occupational and environmental track and explain in connection to my background working in a biopharmaceutical industry with high requirement for safety precautions. And I was very excited when they accepted me into the program. I did my first year at UCD Dublin and my second year at EHESP Paris. And I currently work at Anses in Paris with the team that is currently coordinating an EU project called PARC. I also did my internship and thesis at Anses. So my thesis supervisor is my current boss. This photo was taken for my final presentation at Anses, and here's a cute photo of a dog that was with us. She's a guide dog in training. I just want to share that photo with you there. I managed to get this internship that turned into a job thanks to one of my classmates that set up a small group sessions with my supervisor after he guest lectured at EHESP one day. So that's an example of how an unsolicited application to people in your network may work in your favor. So now that you know about me, let me tell you a summary about my thesis, about my current work, and a little resource that might be helpful for you in finding your next project. So like you can see here, hundreds of millions of tons of hazardous chemicals are consumed each year in the EU. And out of the 100,000 chemical in the market, only around like 10% of them are fairly well characterized for their hazards and exposures. And most of them are unfortunately are still poorly characterized. In the past 20 years, different EU agencies have been making conscious efforts to protect human and the environment through several frameworks that monitors and regulate different chemicals circulating in the market. With the co-funding provided by the EU Horizon 2020, several projects were conducted. And one of the programs that I want to bring your attention to is HBM4EU. This project focuses on the essential human biomonitoring research with the emphasis on translation of scientific results to policy, because in the end, you want scientific results that can be useful and applicable. So this is actually the predecessor project that led into the formation of the project I'm currently working on now. So this emphasis on science to policy and the environmental concerns stated in the European Green Deal and CSS document was why PARC was initiated. This was possible with the funding provided by the Horizon Europe. This is a continuation of the Horizon 2020, which will last from 2021 to 2027, this funding. PARC stands for something very long, Partnership for the Assessment of Risk from Chemicals. It is a consortium consisting of more than 200 different organizations from 30 different countries. And we have 3 EU agencies within our consortium, namely ECHA, EPHSA, and EEA. There are 9 work packages within our consortium, with a total budget of 400 million euro, with the project duration of 2022 to 2029. So every public health project needs a fancy name, and what's a fancy name good for, if not for a pun? This is one of our main publication called A Walk in the Park, which gives you a great overview of every work package in PARC. This is an illustration of all the work packages in PARC and how we work. Our objective in PARC is to consolidate and strengthen EU's research and innovation capacity for chemical risk assessment to protect human health and the environment. And the core of PARC are these 4 work packages, work package 4, 5, 6, and 8. And basically those are research activities. And here's another diagram showing their interconnection between all those 4 work packages. Work package 4 work in the monitoring and exposure in human and also in the environment. Work package 5 works with the hazard, and work package 6 work with a risk assessment process. And for my thesis, I looked into only these 3 work packages. And as I previously mentioned, PARC has emphasis on producing research that can support regulation and policy making. And of course, there's a limited resource and duration, and that's where work package 2 come in with the priorities setting tasks. This task group is where I was a part of during my internship, and I'm currently still working in it. PARC is currently only in its second year, but we're already preparing for prioritization process for PARC year 4 to 7. So that's where my research came in. The objective was to gather perspective of those leaders in work package 4, 5, and 6 and see their experience prioritizing projects during the first round of PARC and to determine potential improvements for the second round of PARC. How we did it was we conducted 3 focus group discussions. Each session's 90 minutes long, joined by 4 to 5 different participants, which are experts in their field. And in each session, there must be at least one representative from each work package. We chose this format to allow collaborations between them. And we ended up with 13 participants working for different government agencies, research institute, and universities from 7 different countries. So we recorded the focus group discussion sessions, and it's a bit of a qualitative research process. We did transcription and coding and thematic analysis. And based on this thematic analysis, we managed to get some themes, and we classified them based on the prioritization criteria that was used in the previous prioritization process of PARC. And we got 3 different themes, which are policy and regulatory relevance. We want to pick projects that can be used in regulatory sense. And the second part is on partnership, synergy and alignment. And the third one is practicality, if we can actually do the projects within PARC. What I would like to bring your attention to is the second theme here on partnership and synergy and alignment, which they found challenging in keeping tracks of the projects that are running in the different work packages and other EU projects. As Karl said, it's very easy to start working in silos. And this is what we found also in our studies, that we shouldn't be working in silos. We should all work together. And like, how do we do it with a project so big? This partnership is synergy and alignment is necessary to avoid duplication of work and to ensure continuation of work, so to speak, not to reinvent the wheel. And there are opportunities that were given by our participants that there should be project mappings, project review, and see what has been going on within PARC and how can we develop them further. And there should be like inter-EU project coordination and how to make use of like Parkopedia, which is our own platform, a Wikipedia and a social media for chemical risk assessment, and what we call SYNET, which is like a synergy network for PARC. So synergy network, like a SYNET, through SYNET, we open invitation to other projects and partnership to formalize channels for collaboration, including exchange of like data and organization of joint events. In addition to this open invitation, we also actively reach out to other EU-funded projects and partnerships to join our network, so to improve our synergies within the chemical risk assessment area. So how does this relate to you, if you might guess? Let me introduce you to the Cordis website. This magical website is listing all the projects that are EU funded. And using this website, I was able to screen through all Horizon Europe 2020 and Horizon Europe projects that might be of interest in forming synergy and collaboration with PARC. You can also use the search bar to look for specific projects like PARC. And once you get to the project fact sheet, you'll be able to see useful information about certain EU-funded projects, like their budgets, their project duration, and most importantly, the project partner organizations that are involved in it. This might be a good way for you to find some interesting projects in public health and maybe reach out to some of them. And for example, here are some public health projects that were funded by Horizon 2020 that, to my knowledge, they're still running. I'll find a way to make this PDF available for you later after the session, if that might be helpful to you. And so, yeah, in conclusion, EPH helped position me in Europe and helped me change field. That's my gateway to public health. As you know, I didn't come from a medical background, so I chose to connect my past experience on how to pivot into public health. EPH also helped me form networks with people that are in the industry and made me aware of EU-funded projects that are happening out, that are happening around me. So yeah, I would like to encourage you to start reaching out to people, to take the leap using all the resources that are already in your inventory, and maybe making those unsolicited applications. But to those of you that are not comfortable reaching out of the blue, there's another website that you might be interested in called the EHESP. It's basically a job vacancy website for all the PhDs and jobs that are happening in Europe. So here's a bonus website for you. So, and finally, thanks again for the opportunity to share this. I hope you gained something from my presentation. If you have questions, you can ask them now or contact me on email or LinkedIn. If you're interested in knowing more about the PARC project, you can follow us on social media. And so, yeah, here's the list of management board of PARC in case you want to follow them on LinkedIn. So yeah, thank you, everyone. I'll take questions if you have them. Thank you.
Thank you so much, Katya. It was really, I think I didn't know about PARC. When you sent your bio, I did check, but I think this is very comprehensive, and I think it is very interesting how it comes together with 200 plus organization.
Yes.
So that's really, I think it's very interesting because it's such a big project. And thank you for sharing your journey through EPH as well. And that's also very much inspiring. I think a lot of us are also doing our internship. So we're also looking forward to what next. So I think that also is very useful at this point of time. Now I will open the floor for questions. If anyone has any questions for our speakers, now is the time. You can unmute yourself or just put your questions in the chat box as well.
Hello, I did have some questions actually. I don't think I introduced myself. I'm Berenice. I'm the EPHSA secretary. So I actually had a question for Karl. I found your talk to be really, really interesting, and I think it's so important because public health is like such a diverse field with a lot of different topics that encompass, oh man, like such a wide breadth of subject areas. Yeah. And so I kind of had a question because I mean, you kind of slightly touched upon like how do all of the schools, how are they able to include all of this? But I feel like you mainly talked about like in terms of expertise. But I'm curious, like, have you guys thought about in terms of time frame? Because especially if you're doing like a master level course, like some programs are only a year long. Or 2 years. And even with 2 years, it's very difficult to include all of that information. So like, how do you balance between getting like a general overview and fitting everything in without necessarily getting into the specificity of things, but yet that specificity can be really helpful? I don't know if you have thoughts on that.
No, absolutely, I do. And the great thing with the ASPHER-CCP, and I'm sort of kicking myself, I didn't mention it during the presentation, is that the ASPHER-CCP is not just master level. It is a curriculum for bachelor, master, PhD, CPD, diplomas and certificates, and also specialty professional training as well. So we're hitting quite across a rather large board here. And with that, as I had said previously, like we can't sort of tie everyone together and say, you must do this curriculum. It's impossible. It's unwieldy. It's rather large. But at the same time, it gives opportunity for course directors and for academics around the European region to look at their curriculum and go, oh, well, that's interesting. That's new. We don't have that. Maybe we should. And it's those sort of little steps. And as I said previously, curriculum really needs to apply to the world outside the School of Public Health. It needs to apply to the students wherever they go, but also generally most of the time when it comes to schools of public health, the examples that they use, the topics they use, will be very much congruent to the country that they are placed in, essentially. So essentially the topics and the subject areas will sort of match to the country's public health landscape, for want of a better word. And that's a very, very important element. But also at the same time, there are subject areas, like the core subject areas for public health there, that should be in all programs. And what's really interesting is even in academia, we do sometimes there are great, as with the general population, there are people who excel at their roles and some who do not. And sometimes you will find programs which maybe are a little bit lacking and maybe a bit lackluster. And that's just based on the basic subject areas. So this curriculum really is sort of that, I sort of see it as like poking a bear with a stick, almost going, look, we need to stop putting our heads in the sand of antiquity and come up to, and the great thing is that the subject areas within the CCP actually present really good topics that are general enough, that aren't too specific, but are general enough that can be applied across the board. And I think that's quite unique, because a lot of curriculums, and I can honestly say I went through, my God, easily over maybe 70 curriculum maps from around the European region and America as well. And what was really interesting is, and as expected, their curriculums were very much created around the landscape where they evolve in. But what was interesting, some areas were teaching, for example, the area of leadership and management, which is very important to public health. There were some countries that were still teaching, and I was rather surprised at this, what's known as the Great Man theory, which comes from World War II, which was a theory that was put forward by Winston Churchill in World War II, stating that the woman's place was at home with the child, and that a man's duty is to do well for his country, which is completely outdated. And there were still one or two programs still teaching this. And I'm like, I'm sorry. I have a twin sister. I'm a feminist. I'm not going to put my hands up there. I'm like, how can someone be teaching that? And specifically when certain colleges, specifically when you have the language barrier there as well with different countries, that they don't always give the context. So it's important, as I would say, to be able to look back to know where you're going, but at the same time, you need to keep your head straight in front of you to see what's coming down the track. And that's what a curriculum should be. You should be able to prepare for what's coming ahead to us, but at the same time, acknowledging what's been before. And that is rather hard, and that really comes down to each course director and their faculty to really come together to look at their curriculum, and maybe get people external to come in to look at their curriculum going, well, you know what, that's a little bit dated. Let's look at this instead. And I think I hope that has answered your question in some way or another.
Yes, thank you.
No problem.
Yeah,
Hi. I'm sorry. I'm currently at home now. So, thank you, Karl, and thank you, Katya, for the excellent talk. I have two questions. To one to Katya and one to Carl. Let's start with Carl first. Carl, like, uh, I'm going to echo your sentiment because I'm part of the ASPHER core curriculum program. Like, I'm going to contribute into public health ethics and law, which is part of core subject areas in public health. So I just want to ask Carl, how can we make this project more visible to its the public health student and public health professionals? And for Katya, my question is like, I think for Katya is like you got like you are fortunate to get jobs from the EPH link or program, like, but how, because I'm not an extrovert. I'm neither extrovert or introvert. So to have this kind of like linkage or like try to apply or try to make connections for the jobs. How you try to like try to overcome this kind of feelings.
Katya,
That's
do you
all I
want to go
think.
first since I took the last one?
Okay, I can I can take that. Um, for me, this one is actually I was lucky enough that it was the first meeting was set up by one of my friends. She's the one that reached out to the professor that hey, I'm interested in your project, and we have a small group session so you can explain more about the PARC project and if there's an opportunity to take interns. So it was a very small meeting. It was three of us students and my supervisor. And yeah, it was just a little presentation. And he basically told us, like, whoever interested, you can decide among you who's more interested in joining this project can go be an intern. I was lucky in that sense because it was there and I decided to take it. But I would like to share maybe another experience of getting an interview at another potential internship placement that I didn't end up doing because of timeline. That was also an unsolicited application. Basically, if you can say, slid into someone's DM on LinkedIn. You can actually, if you have that pro LinkedIn for 1 month, you can reach out to someone that's not on your on your network. That's what I did when I was looking for my internship. I made sure that it's something that I was interested in. I looked up what they were doing and just wrote them an email. I think coming up to a person in person for me who's probably like an introvert was more nerve-wracking than trying to send emails because you don't have to talk to them directly, which was manageable for me. I managed to reach out to like 2 or 3 people that I was really interested in working with, and they kindly, I think they all replied, which was very interesting. And one turned into an interview, and we met up in Paris to have that interview. But yeah, my suggestion is like do what you're comfortable with doing. For me, it was just reaching out through email first. For you might be different because like if it's a big conference, I've never really done it in person. I would try to get their name and stalk them a little bit. I don't know if that's the way. And then yeah, it just isn't. LinkedIn is a very useful tool if you want. And like I said, if you open like project cards in like Cordis website, you can see the organization that's working in that project, and then you can see who's the coordinator, who's in charge, and you can find them on LinkedIn and reach out to them after. Maybe, hopefully that helps. Yeah.
Amazing. So I'll tackle my question now, really around how will the final product be visible and how will it be used and stuff like that. So number one, we are so lucky that the project is being co-branded and it's being co-produced with the WHO European office. So that's number one. That's huge. And with that, schools being a part of the process all the way through, one thing I will say that schools are hungry for the final product. I can honestly say I am getting emails in my inbox like crazy for the past 6 months going, when will the final be ready? When will the final be ready? So people are hungry for it. We also have connections with EPHSA, and EPHSA is the accreditation agency for public health programs within the European region. And they too are also very hungry because their current guidelines are based on would have been the 5th edition of the core competency set that ASPHER created back in 2015. So what can I say? The joys of COVID and all those little things. This has been long coming. And having a curriculum which sort of gives an accreditation agency the ability to sort of pinprick these little elements is so, so important. So as well as it being, the schools are very excited, and not just European schools. I've been contacted through ASPHER. We have a lot of affiliate members from the States in ASPHER and in the Pan-Asia area as well. And it's fantastic that all these schools are going, oh, we can't wait to see this final product. We are dying to change our programs to bring them up to date. And that to me is very fulfilling. It's very fantastic. It's amazing for the future students coming down the road, actually having their programs, shall I say, tailored to what's happening around them. And that is just, it's fantastic. So between those three elements, between the WHO, between EPHSA, and between schools being part of the process from day one, it really goes to show the importance of what we're doing and really shows the impact it's going to have when the final comes out. And the final product will be released at the next ASPHER Deans and Directors meeting, which will be happening up in Porto, in Portugal, this June. So the days are counting by, guys, that's for sure. And we're just so, so lucky for it. And while I'm here, I'll just tackle the next question that came in through the chat. And what do you think about the engagement of students in the process? It has been key. There are over, just give me 1 second now, there are over 190 members on the expert advisory group and the expert consultative group. Expert advisory groups, there's one for every single subject area within the core curriculum. And then we have an ECG, not cardiac tracing, but actually it's an executive consultative group who are sort of that level higher up that actually help with the formation of the final product. And we are so lucky that in every single part of the curriculum, let it be an EAG or the ECG, there are young professionals. And we've been very lucky that we've gotten to portray a lot of the work from the core curriculum all the way through. This has been a 2-year project, essentially. And we've been very lucky that we've been able to link in with EPH Plus students like yourselves, along with conferences, specifically with the World Congress for Public Health. There is a youth organization within that. And we've been very lucky we've been able to link in with that as well. And we also have been lucky to be linked in with Euronet MRPH, which is more akin to the clinicians in the room who are doing public health specialty training after. And we've been very lucky that we've been linked in with all of these organizations all the way through. And literally me shouting opportunities nonstop to everyone going, there is a role for you here. And now we're coming now to the end of the program. We're currently forming the final product as we speak, and it's mind-blowing. And having the opportunity for young professionals to learn from the experts, but also for them to gain that little bit of expertise along the way. And it's so important for everyone's development as well. And that's in regards to the PPI or participatory approaches to research. That has been the way of the CCP all the way through, from schools to students to experts in the field. Everyone has been surveyed, interviewed. It has been fantastic all the way through. And is there anything, I think that's, and how can we engage more students in this process? Well, at the moment, the CCP is now, we're currently creating the final product. So we're already at a pace where there's really no more room to get more people into the process. But do be mindful, out of that 190, there is roughly about 45% of that 190 are young professionals. This is the first time a curriculum for public health has included young professionals at the helm with the experts. So, young professionals, your voices are being heard, which it's one thing seeing that written, but it's another thing seeing it actually happening in practice with the process that we've gotten to this point. Specifically, there are 37 subject areas in this core curriculum. Again, we're not stating every school needs to be teaching 37 modules. That's a lot. But what we are saying is, here is a pick and mix methodology. Use it to enhance your program, to update it, to ensure students are ready down the road. Hopefully that answers your questions, Federica. Thanks, Emil. Pass now on to Katya.
Thank you. So maybe this is a bit of a repetition for me. I don't have anything to add. Like, do you have any advice for a graduate who wants to work in the EU-funded project? I'm guessing if you're now in your internship, make use of your network. It's a good opportunity to like talk to people in the industry, like basically, hey, do you have a job for me after graduation? That's one way to start. Secondly, like those websites that I suggested in the Cordis website, there's very like there's so much so many projects that are happening in the EU right now, and you might just find the one that interests you, and you can just reach out to the partner organization or find out like who's coordinating it, and see if they can offer you a job. Also, like if you're interested in the PhD, like there's another Erasmus called the Mergi Curie program. That's also EU funded, and all of those slots are available in the EURAX's website that I showed you before. Hopefully that helps.
Thank you so much for the questions and for those amazing answers. Before we close, I would like to thank both of our speakers, Karl and Katya, for that amazing talk, and also wonderful participants and the questions.
Thank you.
Thanks again, all.
Bye.
Bye.